For a long time, we thought we had the answer for preventing a certain type of stroke, a surgeon's scalpel. But what if that answer is now found in a simple pill bottle? Today, we're jumping right into a huge medical debate that's challenging decades of established practice.
So let's get right to it. Picture this, a major artery in your neck. It's getting clogged up, and your risk of a stroke is just shooting up. For years, the only real fix was surgery, no question about it. But now, with how incredibly powerful our medications have become, you've got to ask, is going under the knife still the best option? Or is it even necessary anymore?
Okay, so first things first, let's really break down what the problem is. It all comes down to this really dangerous bottleneck that can form in one of the most important supply lines in your entire body. So get this. Research shows that a pretty big chunk of strokes, we're talking about 15 to 20% of what are called ischemic strokes, are actually caused by plaque building up, atherosclerosis, in those big major arteries that feed your brain. The official name for this condition, it's called carotid stenosis. And what that really means is that the internal carotid artery, which is basically a superhighway for blood getting to your brain, is getting narrower and narrower.
And that highway analogy really hits home, doesn't it? As that plaque builds up, it's like a massive traffic jam. And the real danger? If a tiny piece of that plaque breaks off or a clot forms right there, it can shoot up to the brain, block a smaller road, and bam, that's what can trigger a really devastating stroke.
So, for decades, the fix for this traffic jam was pretty straightforward, pretty physical. You just go in and clear the road.
And you know what? The evidence back then seemed totally solid. I mean, we had these huge clinical trials back in the 90s that made a procedure called carotid endarterectomy the absolute gold standard. It was just proven to be way better than any of the medicines they had at the time.
And the surgery itself, at least in theory, is pretty simple. A surgeon goes in, physically opens up that artery, literally scrapes out all that gunk, the plaque, and then sews it back up. The result? A nice, clean, wide-open path for blood to get to the brain.
Okay, but this is where the whole story takes a really interesting turn. Because while the surgery itself hasn't changed much, the world of medicine, it has been totally transformed in the last 30 years.
I mean, the pills they were using in those old trials, they're like ancient history compared to what doctors have in their toolkit today. The change has been so massive, it's making everyone in the medical world stop and rethink this whole thing.
So today's strategy is called Best Medical Treatment, or BMT. And it's not just about one pill, no way. It's like this powerful cocktail of drugs all working together. You've got antiplatelet drugs to keep the blood from getting too sticky. You've got antihypertensives to get blood pressure under control. And the real game changer, powerful statins. These things do more than just lower cholesterol. They can actually make the plaque more stable, so it's less likely to break apart and cause trouble.
All right, so this all sets up the big showdown, right? In one corner, you've got the old champ, surgery, and the other, the new contender, modern medicine. So how do they stack up head-to-head? Well, a recent big analysis gives us some really good clues.
So here they are. On one side, we have revascularization. That's the fancy term for physically clearing the blockage with surgery or a stent. And on the other side, we have best medical treatment, the modern pill-based approach. Let's see what the numbers say about the long run. First up, let's talk about the risk of having a stroke down the road. Okay, so the numbers show the surgery group had about a 4.5% risk. The medicine group? A bit higher, almost 7%. So yeah, surgery still seems to have an edge. But the amazing thing here is just how much smaller that gap is compared to 30 years ago. It's really closed in. Now, check this out. The risk of death from any cause, long-term, the numbers are just incredibly close. We're talking 2.65% for surgery versus 3.14% for medicine. I mean, statistically speaking, that's basically a tie. It's a photo finish. So what happens when you put it all together? The combined risk of either having a stroke or dying? Well, it was about 6.6% for the surgery group and 8.9% for the medicine group. So again, surgery is still slightly ahead. But the big story here is that modern medicine is a really strong contender now. It's not the weak option it was back in the day, not by a long shot. But, and this is a really, really big but, we have to be careful here. The researchers themselves threw up a huge caution flag. The studies they looked at weren't those top-tier, gold-standard randomized trials. So what does that mean? It means we can't definitively say surgery is the winner. We're seeing a trend, for sure, but it's not the final word. So where does that leave everyone? Patients, doctors? Well,
it kind of leaves us on the edge of our seats waiting for the final pieces of this puzzle to fall into place.
And that's where the future comes in. Right now, there's this huge study happening called the Second European Carotid Surgery Trial, or ECST2 for short. And it's designed to do one thing: give us a clear, definitive answer to this exact question.
And the way they're doing it is simple but brilliant. They're taking patients and randomly putting them into two groups. One group gets the best modern pills, period. The other group gets those same pills plus the surgery. And this is what's finally going to tell us, once and for all, if adding that invasive surgery on top of today's best medicine actually makes a difference.
So that leaves us with this really big idea to chew on. We're literally watching medicine change before our eyes. The power of a prescription is going toe-to-toe with the power of a scalpel. The question isn't just, can we operate anymore? The real question now is, should we? And the answer to that, well, that's going to change how we prevent strokes for a very, very long time.